the symptoms of early onset parvo.
When I was 11, my dog died of parvo. I still don't even know to this day what parvo is.
Hey amigos, welcome back to Wikivet channel. Today's topic is quite serious as we are going to talk about canine parvovirus, a highly contagious and deadly disease that affects unvaccinated dogs of all ages, especially puppies. Let's go through the classification of parvovirus. Family Parvoviridae, subfamily Parvoviridae, genus Parvovirus, species Canine parvovirus 2. Canine parvovirus is a non-enveloped with a linear single-stranded DNA genome. It is different from feline panleukopenia virus by 2 amino acids in capsid VP2 protein. Let's go quickly through history of parvovirus. Original canine parvovirus was discovered in 1967 and called canine parvovirus 1 or minute virus of canine. It doesn't have remarkable threat on newborn puppies, but a new variant known as canine parvovirus 2 appeared in US and gradually spread to all over the world. Early belief was that canine parvovirus 2 to be an mutation from feline panleukopenia virus. The two more strains of canine parvovirus, one in 1979 is canine parvovirus 2A, 2 in 1984 is canine parvovirus 2B, also third type canine parvovirus 2C in 2000 discovered at Italy and Vietnam. Now let's see worldwide distribution of canine parvovirus strain. Green indicates canine parvovirus 2A, red indicates canine parvovirus 2B, dark green indicates canine parvovirus 2C. In India, canine parvovirus 2A, a more prevalent epidemiology of canine parvovirus. It spread through direct contact with infected dogs, their feces, or formats like kennel, iron cages, water bowls, collars, even hospitals. The virus can survive up to 6 months in an environment. Mortality rate ranges from 16 to 35%. Risk factors include viral strain, host immunity, stressors like weaning of pup from dam, bacterial and parasitic infection, affects all ages but more severe in the 6 weeks to 4 months old puppies, breed susceptible like pure breeds, Rottweiler, Doberman Pinschers, English Pinscher Spaniel and German Shepherd. Crossbreeds are less susceptible. According to research, dogs are more susceptible which are in vegetarian diet than compared to non-vegetarian diet. Pathogenesis. After entry into the body by oronasal route, there is a 3 to 7 days incubation period before onset of symptoms with shedding of viruses. Viruses replicate in oropharyngeal lymph nodes. After a couple of days, significant amount of viruses have been released free into the bloodstream. Over the next 3 to 4 days, the viruses go to new organs containing the rapidly dividing cells like bone marrow and delicate intestinal cells and forms the intranuclear inclusion bodies. Pathogenesis in gastrointestinal tract. Viruses cause most devastating effect in gastrointestinal tract. In normal intestine possesses little finger-like protrusion called villi. The cells of the villi are short-lived and are rapidly replaced by new cells. The source of new cells in the rapidly dividing area at the foot of the villi called the crypts of Lieberkühn, where parvovirus strikes on the crypts and blocks the formation of new cells from the crypts, especially crypts of jejunum and ileum. The villi become the blunted and unable to absorb nutrients and diarrhea results. The barrier separating the digestive bacteria from the blood causing widespread of infections. Viruses kill the dog by two ways, either by diarrhea and vomiting leads to extreme fluid loss and dehydration until shock and death results. Loss of intestinal barrier allows the opportunistic pathogen invasion. Pathogenesis in the bone marrow. Lymphocytopenia and neutropenia developed secondary to destruction of hemopoietic progenitor cells in the bone marrow and lymphopoietic tissues like thymus and lymph nodes. Pathogenesis in myocardium. Canine parvovirus myocarditis can develop from infection by in utero or in pups younger than 8 weeks of age or born to unvaccinated dams, results in myocardial infection, leads to cardiopulmonary failure or delayed progressive cardiac failure. In some cases, skin lesions include ulceration of foot pads, mouth and vaginal mucosa. Infected dam in earlier gestation may develop infertility, resorption or abortion. Clinical signs include fever, bloody diarrhea, vomiting, lethargy. CNS signs due to hypoglycemia, sepsis, acid-base balance and electrolyte abnormalities. Pathological lesions include bare patches or ovoid, closely packed lymphoid follicles in the mucosa, hemorrhagic enteritis with edema, necrotic area in myocardium of puppy. Diagnosis of canine parvovirus. Diagnosis based on clinical signs. Only 25% of dogs may have non-bloody diarrhea. Severely affected have prolonged capillary refill time, poor pulse rate and also tachycardia. Laboratory tests are complete blood count for identification of leukopenia and neutropenia. Abnormal coagulation test. Cardiac troponin 1 is a plasma marker for myocardial damage. Serum analysis for hypoproteinemia and hypoglycemia. Detection of organisms by fecal ELISA antigen test, specific but less sensitive. PCR methods and antibody detection. Treatment. Primary goal are to restoration of fluid and electrolytic balance, preventing secondary bacterial infections. Fluid therapy should be continued for as long as vomiting and diarrhea persists. Antibiotics. Combination of penicillin and aminoglycosides have best results. Third generation cephalosporins also used. Antiemetics like metoclopramide and prochlorperazine. Serotonin receptor antagonists like ondansetron and dolasetron are used. Broad spectrum antiemetic fenbendazole are also used. This chart contains list of drugs can be used for canine viral enteritis. Prevention. Prevention by vaccination. Both attenuated live and inactivated canine parvovirus vaccines are available. Pups of unknown immune status can be vaccinated with high titer attenuated live canine parvovirus vaccine at 6, 9 and 12 weeks of age. Note: attenuated live vaccines should never administer to pregnant bitches. Most effective disinfectant is household bleach in 1:32 dilution.
That's all for today's video. If you find video helpful, please like, share, subscribe to Wikivet channel.